Today, we're looking at what could be a genuine revolution in oral cancer diagnostics. It's a technology called qMIDS, and it's taking aim at a truly deadly problem. Let's just start with the brutal reality: 10 to 30%. That right there, that's the 5-year survival rate for patients who get diagnosed with advanced head and neck cancer. It's a devastating statistic, and frankly, it's a number that is way, way overdue for a change. So you gotta ask, why are the outcomes so poor? Well, a huge part of the problem is the current gold standard for diagnosis. Right now, a clinician looks at a tissue sample under a microscope. Think about that. It's subjective, it can be really slow, and here's the most critical part. It often misses the high-risk precancerous lesions that need immediate attention. This creates this urgent, unmet need for a tool that's objective, fast, and can actually predict which lesions are going to become dangerous. And that is exactly where the qMIDS breakthrough comes in. It's all about replacing that old-school subjective interpretation with a quantitative, purely data-driven system. So what is it? Put simply, it's a rapid, objective molecular test. It's designed to precisely quantify a patient's cancer risk from one single, tiny tissue sample. The takeaway here: no more guesswork. You just get a clear, data-backed score. And the workflow is just powerful in its simplicity. Here's how it works. It starts with a tiny 1 millimeter punch biopsy. That little sample is then run through a rapid 90-minute qPCR test, which is a standard technique in pretty much any lab. From there, a proprietary algorithm calculates a score and boom, delivers a clear malignancy index straight to the clinician. But the team behind this didn't just stop there. Not at all. They relentlessly pushed this technology forward, constantly evolving it toward absolute precision. And the result of that evolution was just a massive leap in performance. Look at this. The diagnostic accuracy jumped from a respectable 72% in the first version to a staggering 92% in version 2. Now that is the kind of improvement that really changes clinical practice. So what was the secret sauce that powered this jump? Well, instead of just looking at the tumor cells themselves, version 2 began analyzing the entire tumor ecosystem: the surrounding tissue, the structural matrix, the immune cells, everything. It gives you a far more complete and way more accurate picture of what's really going on. And this level of performance isn't just theoretical, or limited to one lab. This technology has been proven and validated on a global scale. We're talking about validation in over 535 patients across incredibly diverse groups in the UK, Norway, China, and India. This proves the technology is robust and reliable. And for investors, that effectively de-risks it by showing that this thing works across all kinds of different populations. And this means the test is quantifying a universal cancer signal, one that transcends ethnicity, age, gender, and geography. The result? A massive, truly universal addressable market. Because the biological markers it tracks are fundamental to the cancer itself, not the person who has it. But diagnosing existing cancer, honestly, that's only half the story. The truly transformative opportunity here lies in predicting cancer before it starts. It's about giving doctors the power of proactive risk stratification. And this, right here, this is the single most compelling piece of data. When you're trying to predict which precancerous lesions will turn malignant, the standard method fails 40% of the time. A 40% false negative rate. That means patients are told they're fine when they are absolutely not. qMIDS v2 slashes that rate to just over 13%. This kind of leap in predictive power has a profound impact. It allows clinicians to intervene early, to actually prevent cancer from ever developing in high-risk patients. This directly improves patient outcomes, it saves lives, and it dramatically reduces the enormous long-term costs of treating advanced cancer. So we're left with one final, powerful thought. This technology isn't just about finding cancer earlier, it's about getting ahead of it entirely. So I'll just leave you with this question. What if we could stop oral cancer before it even starts?